Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are going to study the art of writing quality sentences. The art of writing quality sentences. Right. 10 o'clock in the morning, 26 September 2022. Miss Annie Hall. She's a school teacher suffering from, gastroesophageal reflux, possible stricture, plus or minus. That's what it is. So this is the theme for the day. Occasional. Occasional means not happening or done often or regularly. This is C1 vocabulary. C1 means 400 plus vocabulary. 400 plus vocabulary. You can use the word occasional in your writing and speaking. Occasional headaches. Occasional pain. Okay. Occasional panic attacks. Like that. Occasional means not regularly. Okay, they off and on come and go like that. But you can use the word occasional. So this is the theme for the day. Yeah. Yeah. Now see here, in the first 5 minutes, what you're supposed to do is you have to identify these things. Today's date, you cannot underline, you cannot put a pen, you cannot write anything, you cannot do anything 5 minutes, only preparation time, or you say reading time. So today's date is June 18. So today's date is June 2018, 18th June 2018. Remember that. That is today's date. And next, the name of the patient is Annie Hall, and it is Miss Annie Hall. Miss Annie Hall. Okay. Miss Annie Hall. And the date of birth is given. So write date of birth. Don't write 45 age. Don't write age. Write date of birth. Right? Date of birth. Because date of birth is more important than age. Date of birth is more important than age. Yeah. So I have sent the file to you. I already sent the file to you. You can take that file, okay, and you can keep it with you. Right. Yes. The next one. Yeah. Second part, go through this one. Okay. Provisional diagnosis. Provisional diagnosis means not confirmed. So this is important. Then you are writing to Dr. Jason Roberts, and Dr. Jason Roberts is a gastroenterologist at Newtown Hospital, 111 High Street, Newtown. Okay, and you're asking for, you're writing a letter of referral. Okay, you're writing a letter of referral letter. Referral letter. Audio is 100%. Okay. So can you hear me now? Yeah, can you hear me now? Aparna. Hello, Aparna. Aparna, can you hear me now? You can unmute.
Sir,
Can
your
you?
voice is too low. I can't hear you, sir.
Yeah, can you hear me now?
No,
Now
it
also
is
no.
too low. Why? I
Wait.
don't know. I'm thinking that my
Yeah,
device is
increase your volume. Increase your volume there. I can hear very loudly here.
Yeah, okay.
Increase your volume maybe.
Okay.
Is that clear now?
No, sir.
Wait. Sahaya Vinoka.
Yes, sir.
Are you able to hear my voice clearly?
Yes, sir. I can hear you.
You can hear my voice clearly. Okay, very good. What about Vijay Rani? Vijay Rani, can you hear my voice very clearly?
Yes, sir, I can hear.
Yeah, you can hear. So Aparna, there is something wrong with your mobile. So just increase the volume, or you can try to log in from another phone or computer. Something you can do there.
Okay, sir. Okay, sir.
Right. So try to do something. Okay. Right. Jason Roberts, Newtown Hospital, 1111 High Street. So you are requesting for
Simply.
what? He requires what? He requires further investigation and definitive diagnosis. Purpose. This is the purpose. This is the purpose. Then next one. This is the plan. Okay, you are asking for opinion. Okay, endoscopy if required. This is also the purpose. This is also the purpose, and this is also the purpose. And you are referring, this is a referral letter. You know that now. You are referring to a gastroenterologist. Remember that. Okay. So you are referring to a gastroenterologist. Right. You can see here very clearly. Okay, now go through the medical history, family history, and social history. Social history, medical history, family history, and medical history. Okay. Yeah. So now you can see there. Okay. Right. What are the other important things you can see? So you have to see here. Presenting. Today is the last. Today is the visit. Today is the visit. Today's visit. Okay. Today is the visit. Presenting complaint, dysphagia of solids. Okay, this is the presenting complaint. You can see this one. It is 2 weeks history. It is 2 weeks history. Okay, 2 weeks history. Presented with S. 2 weeks history. And yeah. Now this is the point. Gastroesophageal reflex with plus or minus stricture, possible stricture. Okay. So what does he require? Further investigation and definitive diagnosis, or for opinion, further opinion and endoscopy if required. These are the two things. These are the two things you have to know. Then next one. Okay, what are the symptoms? What are the symptoms? The symptoms are dysphagia for solids. So this is one symptom. You can see there. And next one is epigastric pain radiating to back, level T12. This is the second symptom you can see here. And concomitant to weight loss, 1 to 2 kg. Okay, weight loss of 1 to 2 kg. This is another symptom. Okay, when did this happen? After upper respiratory tract infection. After upper respiratory tract infection. You can see here, following upper respiratory tract infection. Okay, upper respiratory tract infection 2 weeks ago. 2 weeks ago, which was viral condition. Okay, 2 weeks ago. Fine. Next one is, you can see here, and now she has taken medication, okay, with OTC, over-the-counter Chinese herbal product with unknown contents. So this is what the treatment she has taken. She's taken the treatment for this. This is the treatment. And no relapse and remittent course, no sensation of lump. So you can see here, no signs of anxiety. So these are the important points. No sensation of lump and no obvious anxiety. Okay, no obvious signs, no relapse. So it did not commence again. Okay, so these are the signs and symptoms, positive here. Okay, then next one. What else is important here? Now here, recently increased coffee consumption. This is food habit. Okay, this is the general, these are the general things. These are the histories. Okay, then next one, she also takes aspirin 2 to 3 times per month. So this is another one. So she takes aspirin 2 to 3 times per month. And then she, medical problem now, let us see medical problem. She has a dyspepsia. She has a dyspepsia. She has a history of dyspepsia here. Dyspepsia. Okay, recent ones, not old ones, recent ones. Dyspepsia, okay. 2010, she had upper respiratory tract infection. Okay, that is past. No, she also has a dermatitis. She also has a history of dermatitis. Okay, and for that one, she prescribed oral and topical corticosteroids. This is important information. Then next one. Now, regarding personal habits. Personal habits. Okay, she used to smoke. She used to smoke, but a non-smoker since children born. So smoking cessation after children's birth. After the birth of children, smoking cessation after the birth of children. This is mentioned. So where to write these things, I'm going to explain you. Okay, where to write these things, I'm going to explain you. Then next one, She drinks mainly spirits. She drinks socially, occasional consumption, occasional. Just now we have seen the word occasional. So you can use the word here, occasional. See, just like that, occasional means not happening or done often or regularly. Occasionally she drinks. So occasional consumption of alcohol, mainly spirits, has been reported. You can say like that. So this is it. Okay. Then next one. Now you can write personal history is over. Now she can write about family history. Family history. A family history of what? You can see here. Family history of, okay. Family history. What is here? Peptic ulcer. Family history of peptic ulcer. You can see here. Family history of peptic ulcer. Okay. She has a family history of peptic ulcer. So you can write this one. She has a family history of peptic ulcer. Then, now let us take allergies. So anything else? Allergies are there. Yeah, allergies are there here. Allergies. So she is allergic to codeine medication. Okay, she is allergic to codeine. That is mainly important. Okay, dust mites and sulfur dioxide also are there, but medication, she is allergic to codeine. Remember that. She is allergic to codeine. Others may be included, otherwise may be eliminated. Only the important things you have to take. Then next one. Now, apart from this, her body weight. Okay, BMI is 28.2, which says that she is overweight. Which says that it is overweight. So it is important. Overweight means it is important. When today's date, overweight, today, 1860 is today's date. You know, 1816 is today's date. You remember that. So today, according to today's weight, it is body mass index is, yeah, she is overweight. So that's what it is. Today's date. This is today's date. Remember, she is overweight. Body mass index says that she is overweight. Okay. Upon observation, okay. Yeah. Upon measurement today, it is it. Then next one. Now what more? So this is regarding her personal. So first one is the signs and symptoms and other progress. Second one is her histories. Then now what you have done. What you have done is here. What you have done is plan. Yeah. So plan is here. So this is what you have done. This is your these are your recommendations. Alcohol consumption and coffee consumption should be minimized. So that's it. Coffee consumption should be reduced and alcohol consumption should be stopped. Okay, cessation of alcohol consumption. Okay. So these two things can be reduced. And cease means cessation, stopping of OTC product. This you can write. Then pantoprazole. Okay, pantoprazole is the third one. So you can see how we are going there. You can see how we are going there. Right. Yeah. So this is now good. Study carefully what paragraph this may go in. So you have to see which paragraph this may go. This may go into body paragraph 3, main body paragraph 3, main body paragraph 3. You can say, yeah, this is main body paragraph 3. You can write this is discharge plan or sending plan for the future. Future will always be in main body paragraph 3. This you have to write in main body paragraph 3. Organization of the letter I am teaching you. Organization of the letter, main body paragraph 3. Main body paragraph 3. Yeah, that is main body paragraph 3. So what is the body paragraphs? Now let us see those things. Main body paragraph 3 means introduction, conclusion. If you leave them, introduction will be in the beginning. Okay, introduction will be in the beginning. So let us see paragraphs. So introduction. Yeah, this is it. The body. So this is the body. Yeah, this is the body. Okay, so main body paragraph 1. I'm just converting this one. This is main body paragraph dash 1. Then next one is main body paragraph 2. So you can understand now main body paragraph 3 and the conclusion. So this is the style. This is the style you are going to use. So this is main body paragraph means here before the conclusion. You will write this before the conclusion. And this is the plan you can write. The plan. The plan. You can see that the plan. And this is the histories. The histories. The histories. Okay. And this is the main problem. The main problem will come first. The main problem will come first. So here you can take like this. Okay. Here you can take like this. Okay, now let us see. This is the yeah. So that's it. Main body paragraph 3, the plan. This is how it goes. This is the organization of the letter. So we'll be learning sentences. We'll be learning a number of sentences. Okay. Then next one. Yeah. And next one is body paragraph 2 is the histories. You write about social history, personal history, medical history, family history. Write down social history, personal history, medical history, family history. All the 4 histories will go into this body. Then the main problem is the present condition, today's problems and the previous problems, what it should do. The problems, all the problems will go to the main problems. Okay, the main problem and problems will go into the main body paragraph 1. So now let us see. Now this is, okay, so let us see here, presenting complaint. Presenting complaint, this is the point. Okay, this is presenting complaint. Over the counter, all these things will go into body paragraph there, body paragraph 1. This will go into body paragraph 1. Okay, this will go into body paragraph 1, main body paragraph 1. Main body paragraph 1. This will go into main body paragraph 1. Which one? Presenting complaint, dysphagia of solids, and then epigastric pain, over-the-counter Chinese product. All these things will go into paragraph 1. Okay, all these paragraphs will go into paragraph 1 with this one also. Okay, and yeah, lump, yeah, and epigastric pain. This one. Recent coffee consumption is personal habit. It's a personal history, personal history or social habits, social history, whatever she does daily, like that one. So this will go coffee consumption and aspirin. Coffee consumption and aspirin will go into main body paragraph 2. main body paragraph 2. Because these are personal. This is not related to the direct problem. Okay. Yeah. Right. Okay. Right. So you can see here. So till here. So I'm separating so that you will not get confused. So that is body paragraph 2. Okay. Aspirin, coffee, these things, body paragraph 2. These two things will go into body paragraph 2. Then this one will go into main body paragraph 1. Okay. Main body paragraph 1. Because this is the presenting complaint. Dysphagia for solids, number 1. This will go into main body paragraph 1. Then epigastric pain. Epigastric pain. This also will go into main body paragraph 1. Then you can see Chinese herbal product. This also will go into paragraph 1. And concomitant epigastric pain. This also will go into paragraph 1. All these things will go there. Okay. Next one. This plan will go into body paragraph 3. This plan will go into body paragraph 3. Okay. Body paragraph 3. Plan will go into body paragraph 3. Hello, Dr. Nadeem. Why don't you invite your friend doctors in the group? Tell them that there is a session going on. Organization is explained. So this is more important for doctors than nurses. Nurses, they are learning the sentences and the organization. But you need it because this is I'm taking from the doctor's letter. Okay. So it is more important for you than the nurses. Nurses also important, but it is important in the term of organization, picking up the sentences, how to select. So they will get double gain. Okay. Right. Because I'm going to take nurses also afterwards. You also can attend the nurses session. So just to mention, type something in the group of doctors so that they will come and join. Okay, next. So this is plan after referring what they have to do. So coffee alcohol consumption should be decreased. OTC products should be stopped. Pantoprazole, they come advise. These are already going on. So that is what you have said. Okay. That is what, this is your course of action. These are your suggestions, your duty. Okay, you're writing a referral letter and you have already given. So these three things should go into the body paragraph. So only these things. Referral letter is already there, refer gastroenterology. So this is body paragraph 3. So the complete letter is referral letter. So no need to worry about that. Okay. And next, no sensation of lump. No sensation of lump. That will go into main body paragraph 1. All this. Main body paragraph 1. You can say all this. This all. Okay. No relapse. No relapse. Not coming again the problem. So that is no relapse. Okay. Then next one. So no signs of anxiety and no sensation of lump. These also will go there. Yeah. Right. So first one. This is negative. So right afterwards. First write dysphagia of solids, then upper respiratory tract infection, then concomitant epigastric pain. These are all positive things. Okay, positive things, right? These are all positive things. Then next one, all these things will go there. But this weight loss will not come here. Weight loss is not the problem here. Weight loss is personal. Okay, weight loss is personal. Okay, body mass index is personal. Okay, so this is not related to medical. This is the result personal. So this will go into body paragraph 2, histories, personal history. This will go into body paragraph 2. Only this point. Okay, this point is an exception. So this will go into main body paragraph 2. Yeah. So this weight loss is also main body paragraph 2. So this is main body paragraph 2. Just close by that I am posting. Only this one. So from here, okay, right. So this is main body paragraph 2. The last point you can write as this. Okay, next one is, yeah. Now here other things. You upper respiratory tract infection. We have already mentioned this one. This is the main problem which is going on. Okay. The next one is overweight, salt reduction, overweight. This is coming from 2008. Okay, today also she is overweight. That time also she is overweight. Okay, depression. Okay, separation from her best. SSRI fluoxetine for 11 months. So afterwards, fine. Then whiplash injury, she sustained whiplash injury, 1995. Hepatitis A. Okay, whole family infected with hepatitis A. In 1992, sebaceous cyst removed, tonsillectomy in 1983, childhood asthma, chickenpox, measles. So these are not that much important now. So try to avoid those things which are not important. Which are not important. You can avoid those things. Now, non-smoker. This is personal history. Personal history. So what you can do is this will come in body paragraph 2, main body paragraph 2. Main body paragraph 2. Okay. This is personal history. So you can write this personal history because social history or personal history. Okay. This will go into second paragraph in this letter. This will go into second paragraph in this letter. Right. Second paragraph in this letter. Next one is, yeah, obesity. You have already seen this one. This will also go. This will also go into personal history, obesity. Yeah. This one. Right. So because this is also personal, you see. We already mentioned here. Okay, weight loss is required. Okay, weight loss. Okay. 1 to 2 kg. Then next one. Here, this one will be the main point. This is obesity actually. So this you have to include main body paragraph 2. Okay, main body paragraph 2. Today's weight. Okay, today's weight. Okay. So, right. That you can see all these things and you can notify. Okay. Then next one, there is a, yeah, this one, where this will go. Where this will go. She has a history of, this has a history of dyspepsia and dermatitis. This also will go into main body paragraph 2. Main body paragraph 2. Yeah. This will go into main body paragraph 2 because this is medical history. Don't say past medical history, say previous medical. History means past only. So say previous medical history, not past medical history, previous medical history. So like that. So this is medical history. It will go into body paragraph. Not everything, only the relevant information will go there. Only the relevant information will go here. So take care of that one. Okay. Right. Then again, so you have seen all the points. Next step. Okay, body paragraph 1, body paragraph 2, body paragraph 3. So this is the purpose of the letter. Purpose, 2 times he has given the purpose. Now what is the purpose? Let us see here. The purpose is here. Purpose. Purpose is very important. Purpose. First purpose is further investigation and second purpose is definitive diagnosis. Here he has given the purpose why you have to write the letter. That's the purpose of the letter. And in the same way, here also purpose is given. So purpose. Here also purpose is given. So these 2 points. First one is for opinion. Okay, expertise. Okay, opinion. And then yes, right. So yeah, it is important, but it is managed. No, you cannot do anything with it. Managing properly from childhood, she is managing. So that means it has become normal for her. She got used for her. So no need. It is not any more special. Okay, so no need to write childhood asthma. Childhood asthma, that means during childhood she had asthma. Now there is no need. Nah? There is no need now. She is not having any problem related to that now. She's managing. She's managing now. Everything is going on well. Yeah. Important, but finished. That is childhood asthma, just childhood asthma. So now she is able to manage everything and she is doing well now. So no need to write about that. So here, opinion and endoscopy if required. That is number 1. Further investigation and a definitive diagnosis here. there are 2 points now. Opinion, expert opinion, then endoscopy if necessary, definitive diagnosis, further investigation. So all this will go into the introduction. All this will go into the conclusion also. So this is what it is. These 2 things, purpose will go into the introduction and conclusion. So A, introduction, it will go, and E, so that is E, that is conclusion. Both of them, this purpose will go into both of them. Okay, but divide and write. Okay, A, introduction, E, conclusion, both these things. Okay, both these things you will go. Yeah. So A, introduction and conclusion, you will be writing this purpose and conclusion. So the same thing, but don't use the same words what you are doing in the introduction. Don't use. So you can use this in the introduction. You can use this in the introduction. You can use this in the conclusion, or you can use this in the introduction and you can use this in the conclusion. Okay, in the last paragraph, you can write conclusion paragraph. So 5th conclusion, purpose will go into conclusion. This is one and this is one. So what you can write is writing task. These 2 points you can write in the introduction, and these 2 points you can write in the conclusion. So many people don't get the idea how to change. Now the opinion and endoscopy you can write in conclusion, and further investigation and definitive diagnosis you can write in the introduction. So that's very clear, right? Next, so learn the sentences. Okay, learn the sentences how you have to write. So these are the 3 points. So now let us go. These are the 3 points. First one is this one, number 1. Point number 1 is here. Point number 1 is here. Then point number 2 is here. Point number 3 is here. Yeah, these are the 3 points you can write. In body paragraph 3, these are the 3 points which you can write. Okay, 3 points you can write. This is the points. So next one, in the purpose introduction, this is point number 1 and this is point number 2. In the introduction, point number 1 and point number 2. So these are the 2 points which you can write. Investigation, further investigation, and definitive diagnosis. So investigation and diagnosis, you can take these 2 things in the purpose. Okay, investigation is number 1 and diagnosis number 2. In the introduction you can write, and these 2, opinion, okay, 1, yeah, and 2, 1 and 2, opinion and endoscopy if required. These 2 you will write in the conclusion paragraph. These 2 you conclude in the concluding paragraph. Concluding paragraph. Then next one. Now let us say the points. What points will go where? Now first one will be dysphagia for solids in body paragraph 1. Now let us see dysphagia of solids. Okay, presenting complaint. This is dysphagia of solids. Okay, presenting complaint. This is main body paragraph 1. Main body paragraph 1 you are writing here. This is the first point. Dysphagia of solids. Okay, presented with okay, dysphagia for solids. Okay, so symptoms include, okay, complaints, symptoms include dysphagia of solids. You can write that first one. Then next one, second point is epigastric pain. This is the second point. Second point is epigastric pain, which has been radiating back to T12 level. Okay, this is second point. This is second point. You can see very clearly dysphagia of solids is the first point. Okay, epigastric pain is the second point, right? Then next one, third one is weight loss. This is the weight loss. Okay, weight loss is the third point. So this point, weight, obesity is the problem, that personal thing. But this weight loss, you can write here, because weight we are writing here. This is in body paragraph 2. This is overweight, her conditions, personal history. Okay, personal measurements, that is body paragraph 2. But this is weight loss is a problem. This is also a complaint. So this you are writing point number 3. Okay, weight loss. You are writing point number 3. This is point number 3, weight loss. Weight loss is point number 3. So first point is dysphagia of solids. Second point is concomitant epigastric pain. Third point is weight loss. So these are the points which you have to write. Okay. Then next one is number 4. Number 4 is all this happened when. So post upper respiratory tract infection. This is the 4th one. This you can write. When this all happened, you can write here. This is the 4th point, URTI infection. So 4th one. This is the 4th one. Okay, upper respiratory tract infection. This happened 2 weeks ago. So this is the point, URTI. So this is the point. Okay, this is the 4th point. This is the medication, what she has taken. Okay, this. Okay, and what did she do for this one? She prescribed this one, upper respiratory tract infection. She self-medicated. Okay, OTC product. Okay, this OTC product is point number 5. This is the medical condition, URTI, and this is the treatment. This is the treatment that she has taken for this one. So this is called organization. So this is the treatment for this condition. URTI is the problem, and this is medication she has taken, and without consulting anybody. Okay, OTC, over the counter Chinese herbal product. This is the 5th one. This is the medication for this condition, and this condition happened because of, okay, all these symptoms are because of this upper respiratory tract infection. You are presenting with these complaints, and this is your diagnosis, possibly. Okay, post-viral URTI. So these complaints are maybe because of this upper respiratory tract infection which happened 2 weeks ago. That's what it is. This is your diagnosis. Okay, not definitive diagnosis. Question mark means possible. Okay, a preliminary diagnosis. Preliminary diagnosis, not a definitive diagnosis. Definitive diagnosis you are going sending to a specialist because you are not capable to standardize the statement. So you are sending it to the specialist because it goes beyond your knowledge. That's why. So there it goes. Now then afterwards, 5th point, you write this one, over the counter herbal product. Then next one, 5th one is no sensation, no sensation of lump. Okay, no sensation of lump. Okay, this is not there. So this is 6th point you can take. Okay, and anxiety is not there. This is 7th point. No obvious anxiety and no sensation of lump. These are the 2 things you can write here. These are the 2 things you can write here, and it did not relapse. So that's fine. Next one. So these 7 points you can write. So now let us take the 7 points here. Number 1, dysphagia. Number 1, point number 1 is dysphagia. Point number 1 is dysphagia of solids. Dysphagia of solids. Let us take here. Point number 1 is dysphagia of solids. Okay. Okay, point number 1 is dysphagia of solids. Point number 2 is, I think it's a little small enough. No? Number 2 is here, where, yeah. Yeah, this one, epigastric pain. Epigastric pain. So write epigastric pain. Epigastric pain. Second point is epigastric pain. This is the second complaint. First complaint is dysphagia of solids. Second complaint is epigastric pain. And the third complaint is weight loss. These are the negative points. Weight loss. So these are the 3 points. And these happen. Reason for these 3 symptoms are, this is the reason. Okay, those are the effects, and this is the reason. Reason means cause. Cause. What is the cause? URTI. URTI. This is the cause. This is the main reason why these symptoms are occurring. So first the symptoms. Symptoms are the effect. And this is the effect of the cause. What is that cause? The reason is upper respiratory tract infection. That is how you're relating all these things. And for this solution, you gave one solution. What is that solution? OTC product, OTC Chinese product, OTC product, medication, treatment. So this is the medical condition and she gave this treatment and this is the possible symptom. These are the symptoms, not possible symptoms. These are the symptoms, okay, which are possibly because of this upper respiratory infection. And for this infection, she has taken this over-the-counter helper product, okay. Then number 6, you'll be writing about, no sensation of lump and no anxiety. Sensation, lump, and then anxiety, no lump, no anxiety. No sensation of lump and no anxiety. So you can write in, okay. So these are the points. This is main body paragraph 1. These are the complaints. These are the problem areas. So problems. So this is MBP 1, MBP main body paragraph 1. This will be the complaints or the complaint, the chief complaints or the problems, we can say. The problems. The problems. These are the problems or the complaints. So I hope you understand what I'm explaining you here. Okay. So I hope you're able to understand what I'm explaining here. Okay. These are the points. Yeah. These are the problems, how you have to. So this is the paragraph number, main body paragraph number 1. Main body paragraph number 1. First, dysphagia of solids, then epigastric pain, then weight loss. These are the problems, and these problems are the symptoms, which is the complaints. Okay, are the problems, and these problems are maybe because of this upper respiratory tract infection. Okay, this is the main cause, and these are the effects. And for this problem, upper respiratory tract infection, she has taken the over-the-counter product. Okay, and now you are testing them and checking that there is no lump and there is no anxiety. That's the point. Now this is the main body paragraph 1. Next, main body paragraph 2. Now let us see main body paragraph 2. Main body paragraph 2 is this one, recent coffee intake. So main body paragraph 2 we can write here. Main body paragraph 2 will write here. Main body paragraph 2 will be histories, the histories. The histories. Main body paragraph will be the histories. Okay. Histories. Now let us see what are those histories. Okay. The histories are number 1. So the personal history or personal these things. Okay, that is, yeah. So this is it. Recent increase in coffee consumption. So he increased habits, personal habit. So coffee consumption. Okay, this is right about coffee. Okay, that's enough. Coffee. Number 2 is about aspirin. Aspirin, coffee and aspirin. Okay, this is S. Okay, the histories. Okay, aspirin. Okay, aspirin. So that is finished. Aspirin filled. Coffee and aspirin is finished. So personal is over. Personal habits are over. Then go to personal medication here. So you can see, history, personal history, medication, medical history. So dyspepsia and dermatitis. Dyspepsia and dermatitis. He has a history of, or he has had. Okay. Dyspepsia and dermatitis. Third one is dyspepsia, and fourth one is dermatitis. You can write these two things: dermatitis and dyspepsia. Okay, first one dyspepsia, then dermatitis. First one is dyspepsia and then dermatitis. That you can write here. Yeah. 3. Dyspepsia. And then 4 is dermatitis. Dermatitis. Fourth one is dermatitis, dyspepsia and dermatitis. And for this dermatitis treatment, what treatment she has taken? She has taken the treatment of what? She has taken the treatment, a dermatitis treatment. What treatment did she take here? That is number 5, point number 5. She has taken some treatment for dermatitis. What is the treatment? Let us see here. Oral and topical corticosteroids. Oral and topical corticosteroids. So corticosteroids treatment. So this is the treatment. This is the problem and this is the treatment. Okay, you have to write about the treatment also. And then now next one, personal habits again. Personal habits. Go here in the beginning. So now smoking stopped. Smoking stopped. So cessation, smoking cessation. Smoking cessation since the children were born. Okay. So when children were born, you can see here. Children were born 2002. So from 2002 till 2018. 2002 to 2018 means how many years? So you can see reduce from 2018, 18 minus 4, children were born. Okay, 4. So you can say second child, 2004 was born, children were born. Okay, born to the, okay. So there you can see, since the children born, not since the first child was born, since children born. So let us take 2004. So 2018 minus 2004, so 14, 15 years. So you can say roughly 1.5 decade, 15 years. So smoking cessation 15 years back. So she has stopped smoking. She has, 14 years, 15 years, roughly. Okay. So smoking cessation. Number 6, smoking cessation. You can write about smoking cessation. Then after smoking cessation, another problem is also there. So in this personal histories, you write. Okay. Okay. Right. Now let us take here. It's empty space, no? Too much space is there. Yeah, we are taking it here now. And apart from smoking cessation, social drinker. So occasional consumption of alcohol. Occasional alcohol consumption. Occasional alcohol consumption. So occasional alcohol consumption. You can write about that one also. Occasional alcohol consumption. So that is point number 7, occasional alcohol consumption. Right. Then next one, after that one, you can take family history now. You can take family history. Now family history, father has peptic ulcer, mother hypertension and asthmatic. Mother hypertension and asthmatic, father has peptic ulcer. Peptic ulcer, which is related to this problem, upper respiratory tract infection. So see something relation, which is related, you can use that one. Okay. Now here, you can take a upper, okay, upper respiratory tract infection. So you can take this peptic ulcer here. History, family history. Family history. Peptic ulcer. Peptic ulcer. Okay, peptic ulcer you can take. And next one, number 9. Personally, she is allergic to codeine. This one, allergies. She is allergic to codeine. Allergy. Allergy to codeine. So you can say allergy to codeine. So codeine she cannot take. Okay. And last but not the least, now the present body mass index. Body mass index, that is overweight, to 28.2. 28.2. So body mass index. So these are the points. These are all the histories. This will be a little bigger one. Okay. This will be a little bigger one because too many problems are there. Only 3 problems are there. So it will be almost the same. Both the paragraphs will be almost the same. Okay. Next, this is body paragraph 2. So that is very clear. Body paragraph number 2. Body paragraph number 2. Yeah. Next one is, yeah. So if you feel that it is important, you can write. That's yeah, it's okay. Not very important here in this case. Not very important in this case because she is allergic to dust mites. She knows that. She knows that she is allergic to dust mites. She knows that she is allergic to sulfur dioxide. Codeine is the medication that you are going to give. Okay. She knows that but you have to inform this one, right? Because you're going to a specialist, right? So if you feel that these are important, that also you can write. But the most important ones we are taking, right? Then next one. Next, body paragraph 3. Body paragraph 3. Body paragraph 3 is here. Only 3 points, very small. Only 3 points. Okay, what are these 3 points? Let us see. The 3 points are here. First one is alcohol, coffee. Okay, 4 points actually. 4 points actually. 3 points they have given, but 4 points actually. So this is plan. What you have given plan for her. So fourth body paragraph, main body paragraph 3. Main body paragraph 3 is related to what? Plan. So suggestions, your recommendations. Number 1 is coffee. Number 1 is coffee. Number 2 is alcohol. Number 3 is OTC product. OTC product. And number 4 is medication, pantoprazole. 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 So pantoprazole, yeah. This is the plan you have given for her. This is the plan that you have given for her. So let us take here. No. Yeah. So better. Please. Okay. Okay, let it be here only. Because down we need something else. So this is the point. Yeah. So these are the 4 points which you can write in the body paragraph 3, main body paragraph 3. Now introduction. Okay, now introduction. Introduction is remaining now. Introduction, what you have to write? Introduction. This one you can write investigation and definitive diagnosis. So in the introduction part, what you are going to write? This is paragraph number 1. Okay. Introduction. Introduction. What you are going to write? Number 1, name of the patient. So these things will go must. Miss Annie Hall. This is must. Miss Annie Hall is important. Okay. And you can also say about the presentation or the visit. Presentation. Presented with the complaints of 2-week history of gastroesophageal reflux with possible stricture. Presenting complaint. Okay, presenting complaint, that is gastroesophageal reflux. 2 weeks history of gastro. Yeah, that one. Then next one, third one is, this is a referral letter. Referral letter. This word should go there. Referral. I am referring. So referral. This is a referral. That word must be there. Referral. Referring. I am referring or being referred. Okay. Something is there. Important. Referral. Then next one. Fourth one is, what does he require? Further investigation. Further investigation is, don't use the same word. Don't use the same words. Further investigation. Further investigation. So don't use the same word. Use something else. Investigation, evaluation, examination, observation. Okay, definitive diagnosis. Like that one, different words you can use. So the same words I am writing, but you change the words appropriately. Further investigation. I am given the same. Don't use any word which is there in the case notes. Further investigation. And number 5 is definitive diagnosis. Investigation. Do the investigation, then come out with the definitive diagnosis. Definitive Diagnosis. First one is the cause, second one is the effect. Diagnosis. Okay, definitive diagnosis. Okay, and then yeah, these are the points which you can write. Okay, these are the points which you can write for the introduction. For the introduction, you can write these points. So we have seen this one, introduction. Yeah, here we'll write the address. So here only better finish now. Here we can write, this is the introduction. You can write the introduction like this. These are the 5 points you can write in the introduction. Then let us take conclusion. Now conclusion also, conclusion, 2 paragraphs, 2 sentences you can write conclusion. One is, okay, E, that is conclusion. E is conclusion. Okay. Conclusion paragraph will be regarding like this again. So, based on the aforementioned circumstances, so on foundation, some introduction part, or in view of the above circumstances, based on the above mentioned or aforementioned circumstances. Okay, circumstances. Okay, we can recall the circumstances. Circumstances or conditions. Circumstances. What are the circumstances? Show a background. Then next one, what are required here? Now let us see the points here. These points we'll take here. Okay, expert opinion and an endoscopy if required. Expert opinion and an endoscopy is required. Expert opinion. And number 3, because he's an expert opinion and an endoscopy. Endoscopy, you have to reiterate that one. Endoscopy if required. Yeah, in light of the above, in view of the above, anyone you can write. Yeah, circumstances, expert opinion, endoscopy. This is what you have to write. Okay, would be profoundly beneficial, something like that. Comment. Okay, so based on the circumstances, expert opinion and endoscopy are required. Okay, next one, 4th one will be additional, in case any additional information is required, please do not hesitate to contact me. Closing remark. Closing remark. Closing sentence. That is closing sentence of this letter. Okay, and this paragraph and this letter also. So further, so that is related to, you can say, contact me for further, if further information is required, contact me. If further investigation is required, contact me. That is the closing sentence. Okay, those 2 sentences you are writing. This is the first sentence, circumstances, expert opinion, and endoscopy. And second sentence is, closing sentence is further information. Closing sentence. What is the closing sentence? You can say further information, contact, further info, contact me, contact me. This is it. So these are the 5 points you can write. If you require, first one is circumstances of the patient, second one is expert opinion, words endoscopy after your observation. Then next, the third 3 sentences, third 3 points will go into the second sentence. Closing sentence. What is that? Further information if you want. Okay. Then contact me. I'm ready to help you. That is what is the, so 2 sentences you can write here. But introduction, you have to write 1 sentence. That is enough. Yeah, fine. That's fine, Nadeem. Okay. So these are the points which you can write in the conclusion. Right. These are the points which you can write in the conclusion. Now, introduction. Now address. Address will be first. Number 1 is address. So address, there are 5 points here. Dr. Jason Roberts, gastroenterologist, Newtown Hospital, 111 High Street, Newtown. This is address. Okay. Address. 5 lines you write. Jason Roberts, gastroenterologist, Newtown Hospital, 111 High Street, Newtown. Okay. Now I'm going to give you a quick recap of the previous lecture which I have given already. So here it is. Yeah. So here it is. The introduction. So how you are going to write all these things? The point, see here, Annie Hall. Okay, address. So, perfect. So now let us see here. I'm going to give you all the points. You can just go through this. Okay. Right. This is Annie Hall. Case notes. This is the title. Title. Okay, this is the previous video. And these are some points. So Annie Hall. So I'm sending into the classical corrections. So this is Annie Hall. This is the title of a school teacher, gastroesophageal reflux. Okay, right. Now next. Now coming to the point, this is the address. Address is coming in 5 lines. Address in 5 lines. Dr. Jason Roberts, gastroenterologist, Newton Hospital, 111 High Street, Newton. So name of the person, name of the profession, name of the hospital, name of the street, name of the town, 5 things. Okay, so that is how you will write. Then the date. Where can you find the date? Now let us see the date. Where can you find the date? Date is already here. 18 June 2018. Write in full. Don't write 18/6/2018 or 18/6'18. Don't write like that. Okay, write like this, a date. The next one is, yeah, that is a date. So you have written the date. The next one is salutation. Salutation. Now see the salutation. From where salutation is coming? Salutation is coming from the address. So first line, dear Dr. Roberts, second name, not first name. Don't use Jason. From the first name here, from the first name, dear Dr. Roberts, remove the Jason. Okay, dear Dr. Roberts. No, whatever date, no, exam date only you will write, that's all. So for example, tomorrow you are going for, yesterday students will write yesterday's date only, no problem. A date will not have any problem because same day of the exam, what the date only you have to write. There is no problem at all. There is no problem at all, right? No problem at all. So that is date. Exam, what is your date of exam? That only you write there. Blindly you write, that's finished. Nothing else. Okay. Next one. Salutation over. Then the subject. So salutation over. This is salutation. This is the subject now. Regarding Miss Annie Hall, date of birth 19 September 1972, or regarding Miss Annie Hall, aged 45. Date of birth is more important. Date of birth is more important. So better try to write the date of birth. Okay. Date of birth. The first one is more beneficial. So write more that one. That is more important. Okay. The next one. Body. The body of the letter. The body of the letter. So the body of the letter is here. The introduction, the main body paragraph 1, the main body paragraph 2, the main body paragraph 3, and the conclusion. I have already explained that one to you. The next one. So one letter at least learn perfectly. Afterwards, you need not. Don't think that this is too much time. Okay, it needs time. Then the closing remarks. The closing remarks. Yours sincerely, because name of the person is given. So yours sincerely. If the name of the person is not given, Jason Roberts is not given. Only gastroenterologist is given. Suppose Jason Roberts is not there, only gastroenterologist. Then you have to say yours faithfully, because person's name is not there. Okay. So now this is closing remarks. Then sender's particulars. Sender's particulars. So here, sender's particulars. You are a general practitioner. You have to remember what he's telling there. So you are a general practitioner. See here, practitioner. You are a general practitioner. Examining a 45-year-old female patient. So general practitioner, your practice. This is your personal practice. Name of the practice is not given. So leave that one. Just write general practitioner and leave it. That's all. Okay. This is all about the letter, which is very, very important. This is called relevant information. You can take all these things which are important, presentation and plan and everything is here. So some important information you gather from the other histories and other things. Others which are not important, no need, forget that. Okay. So she is divorced, that's why Miss. She is divorced now. That's why Miss. Okay, try to understand. If she is married and with her husband, it is Mrs. But she is divorced, separated. So she is Miss. Remember this very carefully. Okay. Why Miss? Because divorced. If you write Mrs., that is a problem again. Okay. Right. This is how the points are understood. Fine. Then, yeah. So, how to find the relevant information? That is how it is. Yeah, first let me ask Aparna. Aparna is very serious student. Aparna, hello Aparna. You can unmute. Okay, Aparna, you can unmute. Okay, Dr. Nadeem. You can unmute.
Yes, sir.
Dr. Nadeem, yeah, share your experience. How did you feel regarding the session today?
Sir, it was very helpful and beneficial for me, and I got my concerns, all my concerns were clear that I asked you. It was a very good session. Thank you, sir.
Okay, fine, fine. Okay, so that's the end of the session for today. You can write the letters and you can submit.